Complete Health Dentistry, transforming your health for a lifetime.
Good morning. You're listening to Complete Health with Dr. Michael Rogers from Complete Health Dentistry. Dr. Rogers joins us in the studio this morning. Good morning, Mike.
Good morning, Adam.
Good. Thanks for being here. We're going to kind of come back to an issue we talked about a few weeks ago, development, breathing issues, airway issues, primarily in children, but also in adults, and how that affects the whole health. Now, I've heard a commercial running for Complete Health Dentistry, yes. And you mentioned a term in it that it's unfamiliar to me, so I want to ask you if you can explain a little bit. You use the term forwardontics. Now, I know orthodontics, that's alignment of teeth, right? Mm-hmm. What's forwardontics?
Forwardontics is we help the person, or we guide the person into a more proper ideal growth and development through developing the musculature of the face and neck and head, strengthening the tongue, teaching the person the proper posture, tongue posture, and tongue position, along with also teaching them the proper swallow techniques.
This is stuff I think that a lot of people maybe take for granted. Swallow techniques? Really? Like what's the proper swallow technique? You're kidding me, right?
Well, the proper swallow is your tongue should sit comfortably in a rested, relaxed position. Your tongue should sit right behind your top front teeth. Okay. That should be the rest spot. With someone with an open bite, with someone with airway issues, their jaw is separated a little bit and there is no contact with their teeth, so their tongue posture is low. It's set within the framework of their lower teeth, not up in the upper arch. And so what happens is, with this in mind, our tongue is the scaffold. Yep. For how the top teeth should be.
It's like the mold almost around which the teeth...
Exactly, is the form.
Yeah.
All right? So if our tongue isn't up there as a form, the muscles of our face, which are relatively strong, will actually start to constrict that upper jaw. And as that constricts, it causes the face to elongate, and it increases the likelihood of either a forward head posture, airway problems as an adult, and more breathing issues in the future.
So you're saying that a person who breathes through their mouth primarily could grow up to have a much different looking face than if they breathe through their nose with their tongue in the right place?
Correct. There's been studies of twins. Yeah. And that they've done where one twin went through traditional orthodontics and the other twin went through what I'm discussing now.
This for sort of forwardontics.
The forwardontics, which is really facial orthotropics, it's called. Oh. And so it's teaching the muscles, and it's not really waiting till everything goes in and you...
It's less putting a Band-Aid on the symptom and more solving the problem.
Correct. The teeth, when they're crooked, that's the symptom of the problem. Just like a cough. If you take cough medicine, it's a symptom. The cough is the symptom of the cold. Right. The crooked teeth is the symptom of the airway problem. And so what we do in our office is a non-surgical technique, and everybody is different. So it's not just a one-size-fits-all philosophy, but what it does is it retrains or helps the child retrain, or the young adult retrain, their muscles of their head and neck with techniques and things like that, and appliances that they wear at home to develop this musculature.
So, I'm hearing that mouth breathing and the way you swallow, basically the way your tongue rests inside your mouth, can all affect the way your teeth, your face develop, and then the way your airway develops or doesn't develop. What about, how does posture play a role here?
Well, once again, if your shoulders are rolled forward, and like many people do when they're sitting over a computer, or many people do while they're texting on their phone.
Guilty as charged,
Or if you're like nowadays, a lot of people lay on the couch and eat dinner instead of sitting at the dinner table, the dining room table, or the kitchen table, eating dinner in a more upright posture. I use the example when I was a kid, my mom would always say, sit up straight, eat with your mouth closed, chew your food 30 times.
Thanks,
Nowadays,
Mom.
right. But nowadays, our diet is softer. There's more carbohydrates. There's more processed foods. So our body, our muscles don't have to function like they used to. It's not strengthening them and developing the cheekbones, the facial width that we should be developing. But we're thinking we're doing good with all these softer diets, but it's actually harming us in the long run.
In a prior episode, you were actually saying back in kind of the Middle Ages, the aristocracy, the really wealthy folks who could kind of afford to eat these softer, sweeter foods, their faces were, if you look back at fossil or I guess historical records and old skulls, you see a significant difference. And paintings too.
Paintings are great because we've got so many of them from that time frame, and you can see the facial differences between the people who were wealthy and the people who were poor.
And it came down to what they were eating, pretty much.
Eating, and as I had talked about in a previous show, was, just the way we start.
Yeah.
When all of these airway issues can start the day you're born, in theory. So if you want to help your child grow and develop the best way they can, studies are showing now that breastfeeding solely for the first 6 months minimally is ideal. If you can breastfeed longer, that's fine because it's strengthening the muscles of the face, the neck, the tongue. It causes you to have to breathe through your nose. You have to work at getting nourishment. With a bottle, you don't have to work as hard. Mm-hmm. And so there too, everybody also now sticks a pacifier or a binky in a baby's mouth to there too, it's not strengthening the body or the facial muscles. That should be a pacifier, or that should be, if you're going to use it, and I'm not advocating using one, but if you're going to, it's after they weaned. And then not going into the softer diets like a lot of these commercial baby foods are, real soft, mushy stuff. It's get them into something where they have to use their muscles to chew. Harder food substances where the muscles have to work. Yep. One, it tires the child out, but it's true. Yeah. It tires the child out, and then when they're able to nurse the next time, they're more apt to nurse much better.
Now, we're going to take a break in just a minute or so here, but I want to kind of set up the discussion that we'll have when we come back. You see a lot of parents with kids whose smiles at very young ages, their teeth, the young teeth come in, the deciduous teeth.
Yes.
Paying attention. The deciduous teeth come in and they're perfect. They're tight together. They're all perfectly straight. Explain to me just quickly, if you can, why that's actually not such a good thing.
Well, adult teeth are usually anywhere from 1.5 to 2 times the size of baby teeth. So if the child's teeth are perfectly lined up, there's no spaces, they're a textbook beautiful smile. Yep. Then you've got to start to worry, when these permanent teeth come in, is there going to be room for these adult teeth to come in? Most likely not. Uh-huh. They're going to wind up coming in either corkscrewed or twisted, or pushed in or pushed out. There's just not enough room. And a lot of times that's just because the facial development hasn't broadened everything to give it a good arch form.
When we come back, we're going to talk about some of the solutions that you can explore if your child's teeth are perfect with no space now, meaning that when the adult teeth do come in, there will be some crowding, how you can preemptively solve that problem and some of the options. And hopefully we can talk about ways to do that without necessarily extracting any of the teeth. We'll be back on Complete Health with Dr. Mike Rogers.
Does your child or grandchild snore, have dark circles under their eyes, wet the bed, sleepwalk, have nightmares, or have been diagnosed with ADHD? Did you know these and many other conditions that are present in our children today may be an indication of improper growth and development caused by difficulty with their airway, breathing, and swallowing? These conditions, if left untreated, can lead to health problems in their future. Hi, this is Dr. Mike Rogers of Complete Health Dentistry of Northeast Pennsylvania, and I can help. In my office, we help by guiding growth through a program we call Forwardonics. By realigning chewing pressures, rest posture, airway, and swallowing, we can redirect your child to eliminate these problems and get them back on track to proper growth, development, and breathing. Call me at 570-253-5000 to get your child the air they need.
Clean Health Dentistry. Transforming your health for a lifetime.
Welcome back. You're listening to Complete Health with Dr. Mike Rogers. I'm Adam Owens, and Dr. Rogers from Complete Health Dentistry joins us in the studio this morning. Good morning, Mike.
Good morning, Adam.
We're talking about airway issues and some of the factors that can contribute to problems with a person's airway, with their ability to breathe naturally and easily. One of the things that we've been talking about, too, is as a young person's teeth, as a toddler or an infant's teeth come in, their baby teeth, their deciduous teeth, and if they come in perfect, if they come in tight next to each other like a picture-perfect smile, as a child, that's actually an issue potentially because it means that there may not be enough room for the adult teeth to come in, right?
Correct.
So if that's the case, if my kid has a picture-perfect smile, but it's all the baby teeth, and I realize, oh boy, crowding could become an issue as the adult teeth start to come in, is this a problem that we can solve at this stage, or do we have to wait for all the adult teeth to come in?
Well, I like catching things early. You know, my philosophy is if we can catch them early and retrain them, get them to breathe properly. And breathing properly isn't something that is very noticeable a lot of times because you're so used to looking at your child the way they are.
Right, it becomes the normal.
Right. And the child doesn't know any different, so that's the way they've always been. And so getting things addressed early is far better than waiting till the future, because just like everything else, the longer it sets in, the longer it goes, the harder it is to correct it.
Yeah.
And I'll use an example. You know, if you're flying from New York to Los Angeles and you're off 1 degree at the beginning of the flight, by the end of the flight, that 1 degree, you're thousands of miles off.
Yeah.
But you've got a lot of time to correct it so you can get back in.
Good example.
If you're in a flight and you're flying and you're just breaking into California airspace and you're off 1 degree, you have to make a drastic turn to get it back down. And it's a lot more aggressive to get it to where you need to be. So catching it early is like that flight from one side of the coast to the other, where, we can address it, but if you leave it go, you're going to be way off course, as opposed to waiting. And waiting, that's most people, traditionally, it's waiting till the permanent teeth come in so we can put braces in because you need braces. Or I want invisible braces. Right. Invisible braces can correct it. But once again, we're talking about the symptom. The symptom is the crooked teeth. It's not all the things that we're seeing as the child is growing. The grinding and clenching of the teeth, the worn baby teeth, the bedwetting, the night terrors, the nightmares, the ADHD. All of these things are symptoms potentially of an airway issue that if we can address it sooner and get them breathing well, i.e. meaning correct that flight path earlier, we can avoid a lot of these things that the children are going through now.
So, so let's say a young person comes in with those tight teeth. Do you need to extract them to make more room, or what are some of the options that you can do?
I avoid extractions on teeth to create room because it only creates more problems in the future, creating a tendency for an adult to have sleep apnea or airway issues as we mature. And so expanding, making the arch wider. Our bones aren't solid concrete, meaning some people look at it, it's set in stone, it's in bone. It's not. It's a bone is a malleable, meaning a soft moldable material that if you start to put pressures on them, regardless of age, you can get movement, you can get motion, you can get expansion. That's how our bones, if you break a bone and you're 90, your bone still heals. it's malleable, it's fixable. And that's the whole point here is we can stretch things. Granted, it's harder to stretch things when you're 90 than when it is when you're 3.
Yeah.
And there's growth and development that goes along with us when we're 3, 4, and 5 that we can use to help maximize and get us corrected better. But once again, it's not set in stone. It is a living part of us that we can fix.
And this kind of goes back a little to something you said earlier, which is sort of catch it early. And then speaking of something you said earlier, you mentioned that these airway issues, these breathing issues can result in, the symptoms can come out as bedwetting. Really?
Yes.
How is that? How does that work?
Well, once again, it's difficult to kind of correlate how breathing and sleep problems and airway issues can create bedwetting issues.
Yeah.
But the studies from Stanford, from the Mayo Clinic, from Harvard, all of these big institutions show that bedwetting is a lot of times related to airway or sleep issues in children. And so once again, if we can correct the airway, we can correct the bedwetting. Likewise with ADHD, back in 2011, ADHD was diagnosed, I think, 13% of the time. Mm-hmm. Now in some areas, it's 33% of the kids are being diagnosed. I look at it, I put all 3 of my children went through traditional orthodontics. 2 of them I did the orthodontics on, and now I wish I knew then what I know now. I put my kids through a lot more growth and development appliances, but I would have started them even earlier than what I did to maximize their airway and to help them benefit them. So using that as a guidepost for me is I want to help everybody that I can so their kids don't have to go through the difficulty or the embarrassment of having bedwetting issues or ADHD, or if we can avoid braces, because these things, the treatments we do in some instances, they can do it at home without ever having to leave the house with an appliance.
Well, that's great. And again, it just, I kind of keep hearing you come back to this, catch it early, begin treatment on it early. Okay, here's a question. Is there such a thing as too early?
Well, most people, or most of us that look at people this way or airway patients this way will say start somewhere about 3.
Okay.
Because if you can, because the child is able to cooperate, the child is more willing to function and work with you.
And be bribed with lollipop. Well, not lollipops.
Yeah, don't go there. But not even bribing.
Yeah.
It's just, it becomes a way of life.
Yep.
You get them doing the exercises, you get them sitting properly and posturing properly, because it is all connected, and so if they're slouched over, it's looking back and how do we sleep? How do we let our children sleep? How much TV are they watching right before they go to bed? Mm-hmm. How much of that stimulation? Because that plays a part in sleep and how well we sleep as well. So, all of these things, what's our diet like? These are all things that we discuss in our office with our patients, because it's not just one thing that creates improper airway and sleep. It's all of these things coming together that play a part.
We're going to take a quick break, but before we go to break, I just want to ask you to maybe list out some information about your website, your phone number for the business, if people want to come into the office and have a chat with you. Yeah,
our office is located in Honesdale. Our phone number is 570-253-5000. The website's Complete Health Dentistry of Northeast PA, NEPA.com.
My guest in the studio for Complete Health with Dr. Rogers is Dr. Rogers. Mike, thanks for coming in. We're going to take a quick break. When we come back, we'll talk about some of the options for treating airway issues in Dr. Rogers' office. Stay tuned.
Do you snore? Do you wake up tired? These are signs of sleep apnea. Obstructive sleep apnea afflicts 1 in every 5 Americans. This can lead to stroke, stress on the heart, and even sudden death. Did you know that dentists can treat sleep apnea? Hi, I'm April at Complete Health Dentistry of Northeastern PA. Dr. Rogers uses oral appliance therapy to help patients manage their snoring and sleep apnea. Oral appliances resemble a sports mouth guard, and they are an effective alternative treatment to the CPAP machine and mask that is traditionally prescribed. Our patients prefer oral appliances because they're comfortable, easy to wear, quiet, portable, and easy to care for. If you have been diagnosed with sleep apnea by your physician but are unable to wear a CPAP, give us a call to discuss alternatives for you. 253-5000.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry of Northeast PA. And today on the program, we're discussing airway issues, breathing issues, and something called forwardontics. This is a relatively new term for me, Doc. Can you explain a little bit?
What we term forwardontics is actually facial orthotropics.
So facial, I understand. Ortho, teeth, right?
Well, right.
Tropics.
It's the function. It's the function, how everything functions together. So when we look at this term forwardontics, we're guiding the child or the patient through a more proper growth and development by getting them to posture better, function better, put their bite in the proper position more frequently on a regular basis. It's retraining muscles.
Muscle memory, I was going to say.
And getting the child to, or even the young adult or even the adult, to overall posture and well-being, because it all is part and parcel. The head bone's connected to the neck bone. The neck bone's connected to the backbone.
Yeah.
And once again, we've got to stand up. There's more and more young people, teenagers that I see walking around, especially young ladies, that they're hunched over already. You know, I've got a 99-year-old aunt who has that hunch.
Mm-hmm.
And to me, it's devastating. So if you're starting out at 15, 16, hunched over like this, what happens when they're 60, 70 and they're into osteoporosis, and it's going to be even more significant
this
for them.
This kind of goes back to that example you gave of the airplane flying from New York to Los Angeles, and just a little deviation from the course in the beginning might not look like a whole lot, but if that maintained through that entire trip across the country or that entire trip through life, by the end, it's going to be a very substantial deviation.
Exactly.
So if I come to your office with an issue like posture or something, what are some of the things that you'd have me do? I mean, are you going to hook me up to a little electric zapper and shock me every time my shoulders fall forward, or what?
Well, no, and there too, it's a joint effort. We try and incorporate with other modalities of medicine. You know, chiropractic, physical therapists, because we've got to retrain the muscles. You know, if you catch the child wrong or early and it's an airway issue, we can help correct that child just by having mom and dad work with posture at home, by wearing appliances at home and at night to help correct tongue posture, to help correct muscle posture and jaw posture and position. And so once again, it's starting early is easier to train. The other thing is getting the child to eat dinner or eat meals at a table sitting upright, proper posture. Like I'm a little older than a lot of people, but I'm older than Adam. So it's how my mom used to say, sit up straight, stand straight, stand with your shoulders back.
See, you're kind of teaching good habits, but at a very early age.
Well, that's the thing. And that's part of it, but it's also a nutritional aspect of it. If we go right from, say, even if you are breastfeeding and you went right into a soft diet, or you right off the beginning, the muscles aren't growing like they should. They're not developing. They're not getting stronger. Those muscles, as they strengthen, will pull the face, make the face wider. And as long as the tongue is the scaffold of the design, as long as the tongue is in the proper position. But if the child doesn't know where the tongue needs to be and nobody's reinforcing it, then the face will narrow, the jaw will slack down, not be in proper position, and all of these problems can arise. We talked about them: clenching and grinding, wearing of teeth, ADHD, bedwetting, nightmares, sleepwalking, just tossing and turning at night, tired during the day, aggressiveness on your child, inattentiveness on your child, falling asleep in school, things like that, or can all be part and parcel with it.
The more I think about it, the tongue is really located at the center of the whole head, it just about seems like, and everything kind of radiates outward from that. And so if the tongue is setting up the place for the teeth, and the teeth are setting up the positions of the bones in the face and everything, it really just maintaining that tongue posture, it almost seems like an afterthought or an easy thing to think about. But if that goes a little wrong, again, going back to that example of the plane flying across the country, just a little deviation there can cause a big change.
A big change. Because we've got to remember, if the tongue is low in the jaw, meaning if it's just within the teeth of the mandible, the bottom jaw, not up where it's supposed to be sitting on the roof of our mouth, the muscles tweak in, they pull our cheeks in. And as that collapses our mouth, it pushes up on the roof of our mouth. The roof of our mouth is actually the floor of our nasal passages and our sinuses.
Yeah.
So as that pushes up or collapses upward, it can create deviated septums. It can create, there's turbinates that warm and humidify our air that comes in through our nose. It collapses those or constricts those. So once again, it creates an airway issue that makes it harder to breathe through. And so to try and breathe through the nose, it becomes difficult for people. If you're breathing slowly through your mouth, it's going to increase the likelihood of swollen tonsils and adenoid issues. And so now, as I've got CT in my office that we can evaluate airway on kids and adults as well. And what it is I see these airways issues, x-rays come through, and their airway, they're breathing through the size of a swizzle stick.
Very tiny
So
airway.
a coffee stirrer.
Yeah.
So here, that's where all these health issues, ADHD, we've talked in the past that you can live for 3-4 weeks without eating. You can live for 5 to 7 days without any water. You can only live 6 minutes without air. So we're constricting these airways and asking, well, why can't my kid focus? Why does my child have ADHD?
You're taking away air.
We're preventing the very thing that's allowing our children to grow and develop a brain that we really need to help and give it as much oxygen as it can be.
And again, these problems certainly affect children, but are also can also affect adults.
Yes.
Okay.
Yes.
And an adult who wants to come in and speak to you about an issue like this, not an unusual request. Not an
unusual request. Many adults come to me with that in mind, because the only treatment they were given was you need to have your jaw cut and split and do all kinds of things. And as I said earlier here, our bone is a living entity within us. It's malleable, it's fixable, it's movable. Yes, if we do surgery, fixing it, cutting it up and making it fixed, the bone's going to heal.
Yeah.
It's malleable, it's fixable. We can do a lot of that, not to the extent we can on a 3, a 5, a 10-year-old that we can, but we can get things closer to where it should be ideally.
My guest on Complete Health with Dr. Rogers is the guest we always have on Complete Health with Dr. Rogers. It's Dr. Mike Rogers. Mike, we're about to wrap up here, but as we do, I just would like to ask you if you can tell folks how they can get in touch with your office if they have more questions about this or if they'd like to set up an appointment.
Fantastic. Call my office if you're concerned about your child, if you're concerned about your grandchild, if you're concerned that they have these sleep issues, bedwetting, ADHD, nightmares. Call me, 570-253-5000. The website is Complete Health Dentistry of NEPA.com.
Dr. Rogers, thanks so much for talking with us this morning.
Thank you, Adam.
Complete Health Dentistry, transforming your health.